All right. Hello. We are here with Dr. Dan Water, one of my favorite people, brilliant clinician, excellent supervisor, author, musician, and just all around one of the coolest people I know. So thank you for being here
Thank
with
you.
us.
Oh, my pleasure. My
And
pleasure. Thanks for having me.
yeah, we're going to talk a little bit about your upcoming course, The Existential Importance of the Penis, which is also the title of your book, which is
Mhm.
incredible, and everybody should pick up a copy. So tell me about this course.
Yeah, so I think it's going to be a lot of fun. For one, I always try and make these courses kind of fun. I think they're going to be it's going to be very informative, loaded with a lot of case studies. The way I like to teach is through narratives and stories, and so we're going to be talking about a lot of different cases where I'll talk about different presentations of sexual problems that men have that are existentially based. We'll talk about some effective ways of treatment. I have some new, or at least different, treatment ideas than a lot of other sex therapists. So I'm going to be presenting those. But the essential thesis of the workshop is that men are emotionally much more complicated than is often recognized. And because men are not always as articulate in expressing those emotions as they probably ought to be, a lot of times their emotions become somaticized. And when it comes to relational issues, especially things that stem from early relational trauma, the conduit for male emotion is often the penis. So I sometimes use the phrase the penis speaks. And so in this workshop, I'm going to talk about how to, as clinicians, sort of understand the messages that the penis is giving and how to help our male patients better understand what's going on inside of them, what messages their penises are sending them, and then having better strategies to deal with those things so that their bodies don't have to speak for them.
Yeah, so it's really unfair the way we sometimes simplify the, issues that men are experiencing. And so it's really much more
Yeah.
complex with what you're saying.
It is, one of the things I'll show in the class is there's this visual, this slide that I have that lots of people have seen before. It's a very commonly, frequently used slide, and it separates the differences between men and women's sexuality. And the way it does that is it shows women and women's sexuality is represented by all these dials and graphs and switches and buttons. And sexuality is represented by one toggle switch that says on, off. The implication, being that men's sexuality is simplistic, it's mechanistic. The problem is that slide, even though it may be used in a joking way, is really very reductionistic and insulting, to men. Men are much more complicated emotionally, much more complex. And I hope that by the end of this class, people will have a better understanding of exactly how that manifests itself. So, as an example, I do believe that a lot of sexual dysfunction, and I focus on men mostly because that's who my patient population is primarily. I work with couples, gay couples, heterosexual couples. I certainly have some women as individual patients, but the majority of my individual cases are men. And what I have come to see over the years is that a lot of times when men experience sexual dysfunction, it's actually a self-protective mechanism. In other words, there is something that gets triggered in them that feels threatening to their existence. And as a self-protective mechanism, their penis is shut down to create some distance, self-protective distance. And I think that's the key to really understanding a lot of what complicates sexual functioning for men. We look at it in such a mechanistic way, and our interventions focus on, let's get the penis working, let's get the penis working, continuing to focus on the symptom, which I think often overlooks what's actually creating the symptom, or what's driving the symptom, or what's maintaining the system. So, symptom rather. So, as part of this class, my emphasis is going to be on telling men's stories, helping people learn how to interpret and help men interpret their stories, and then give them some truly helpful strategies for resolving these underlying issues.
Yeah, I think, of course, helping them understand, because when they don't, I would imagine it really impacts their self-esteem, feeling like, why aren't I working
Oh,
how I'm supposed to?
well, yeah, yeah. I mean, and not only does it impact, self-esteem, but it's really perplexing. Like, most people I have found come into sex therapy, they can identify what symptom they're experiencing that's bothersome to them, but they genuinely have no idea why. Why is this happening to me? What is wrong with me? And, when men's penises aren't working the way they're supposed to, this is when you really feel the pain of men describing themselves as broken, as less of a man, as inadequate. Um, and when you think about some of the things that men are willing to go through in order to restore penile functioning, I mean, direct injections into their penises, vacuum pumps, surgical implants. There's much more to this than the desire to have sex. That's what we often focus on. Sure, that's a part of it, but there's something much more central to a man's sense of vitality, of aliveness, of the ability to experience a joie de vivre when their penises are functioning as opposed to when they're not. And it goes well beyond sex.
And you mentioned treatment and ideas and things that we're going to learn. Can you give us like one takeaway, like one intervention, one treatment that is helpful and that you use?
So, a lot of my treatment is based on a trauma type of model. I do believe that a lot of what, as I alluded to before, what creates a lot of the sexual dysfunction is a self-protective shutdown, and that self-protective shutdown is the result of a triggering of some early childhood trauma. So, given that kind of a paradigm, I look a lot at the work of Bessel van der Kolk, the trauma psychiatrist, and his book, The Body Keeps the Score, which a lot of people are familiar with. They don't always think of it in terms of sex therapy, because I don't think he says anything about sex in that book at all, other than maybe sexual abuse, and sexual assault. But in terms of sexual dysfunction, I don't think he says anything about it at all. But I believe his theory that trauma that is repressed or unacknowledged or unresolved is going to reside in the body. And it's not just going to sit there, it will at some point break through in some somatic symptom. I believe that a penile shutdown is exactly that somatic symptom that's the result of relational trauma. So a lot of what I do in treatment, and again, this is not sort of one of those little bag of tricks kind of treatment things, but I think that it becomes very important to help men identify the trauma that's been triggered for them, and by bringing it to the surface, it can be dealt with, and that's what resolves the sexual dysfunction. Trying to bypass the trauma and just focus on exercises designed to, strengthen the penis, for example, will ultimately fail.
Well, I am really excited as always for this upcoming course, and thank you for sharing a little bit with us, and looking forward to it.
Me too. Me too. Always love coming to MSTI. Can't wait.